Can you introduce yourself?
Hi, I'm Braden Fries. I'm a certified nursing assistant at Bethel Lutheran Home in Madison.
And can you tell me, has coronavirus affected you?
Well, my residents most definitely. About a week ago, the CDC gave recommendations to the board that they close off access to the building for visitors. So the residents are having a pretty hard time not being able to see their families. Um, there's a lot of really downers right now. They're just really bummed out because it's got to be hard not being able to see your grandkids and your kids for an extended period of time, and the uncertainties kill them.
So, being a part of the medical staff, being a CNA, how do you guys feel about the rules and regulations that the government is putting in place for nursing homes?
Well, they're pretty in line with the standard precautions that we've already had set up for years and years. We have our standard personal protective equipment, which would be a gown, goggles, our gloves, and a mask. But we're running short even here in Madison. So the supplies are limited, and that's starting to affect us because we don't know if anybody's got it, and we don't want to spread it. So it's a pretty hard deal.
So, as COVID-19 has been spreading, have you guys taken any extra procedures or cautions that you are
The
implementing?
only thing that we've done since this has come out and been a big thing is close off the doors. I mean,
Close on
that's pretty much all we can do at this point. There's At the beginning of every shift, all the nurses and staff have to come in and be screened by a nurse, which entails getting your temperature taken, and they have a certain amount of questions that they have to ask to make sure you haven't been in contact with people who have traveled in a plane or people who have been sick, or if you're sick. And you're not allowed to work with a temperature that's over 100 degrees. You're sent home immediately for 7 days.
So, how are the residents handling seeing their family this way, or vice versa, the family members seeing their parents this way?
Well, they have it set up so we have a dining room where residents can go sit, and their family can come sit on the other side of the window and talk through the glass.
On the outside?
Mm-hmm.
Okay.
And it's nice. They really enjoy getting to see them, but of course it's not the same as being able to be in the same room and hug and love on each other. It's difficult, but I mean, it's better than nothing.
So, are you guys getting any kickback from the families by the families having to visit their parents from the outside of the facility?
Towards the beginning of this, it was really hard for them to accept. We had a lot of people who would come to the door, try to walk in and not understand. We had signs up explaining what was going on, that we couldn't have visitors due to the COVID. And so that was hard for them to accept at first, especially since it was short notice like that. But now that time has passed and people understand the gravity of the situation, it's not an issue at all.
How has the residents themselves, how has their demeanor changed with this virus going around?
Well, you have a few different types of residents. There's residents who are completely clear-headed. They know what's going on. They can stay up with the news. They talk to you. They express their feelings. And then there's residents who are very confused and don't have any grasp of what's going on in the outside world right now. So some of the residents are really down about this. They get depressed, and it's hard for them to accept that all these changes where they can't see their family and they can't go outside. There's limited mobility, like in the dining room when we have our meal times. We can only have a set amount. I think there's no more than like 10 residents in the dining room at all times, when there's almost 60 normally. So it's an unusual atmosphere for them, and the rest of the people who don't have to be fed by staff have to eat inside of their bedrooms. So it's a big adjustment for them, and there's got to be a lot of emotional kickback for them.
So, do you feel that these rules and regulations being implemented are fair to the residents who are spending virtually their last few years in solidarity now?
I think that they've accepted it pretty well. There's not much more we can do. We're doing the best that we can with the information we're given. I mean, the CDC doesn't even know that much. They're learning a lot about this virus, but if they don't have enough information to be able to prevent this thing, a nursing home isn't going to be able to do much more. So we just have to listen to what the government officials tell us to do and hope for the best.
So, have you felt the stress risen among both the staff and the residents, knowing that this virus going around is mainly targeting the elderly?
For sure. The staff seem to be handling it pretty well. They're all, worried, and because if anybody in there, now that we have our little quarantine going on, if a resident gets it, it's probably because one of us brought it in, and that's got to be a lot to live with if you are the one to do that. But the residents, for the most part, they've seen this kind of thing before. They've been through a lot of different viruses and a lot of different diseases, so they're treating this just like another one. Of course, they're scared and they're conscious that this could really hurt them, but they're not letting it ruin their whole lives,
What is the thing that they're most worried about then?
I think they're more worried about their kids, their grandkids, people like that. They aren't too self-absorbed with that kind of stuff now. Most of the people there are very content with what they've done in their lives. They're very clear-headed, very calm, happy people, and this virus isn't going to take that away from them. But they do worry about their kids.
Do you see any time limit for the procedures that you're putting in place now?
There was a time limit. It was only supposed to last a week, but it's been extended because we don't know the severity of this virus or how long it's going to take. So there's no certainty in any of this. We have no concrete answers.
So here in South Dakota, has the residents started any activities or anything to stay positive and hopeful?
They usually have bingo and other activities that they do in our dedicated activities room with the chapel staff and the activities staff. But because they can't leave their rooms a lot, they can only have a few people in the room at a time. So they have a group they have bingo days now, where they do a Monday, a Tuesday, and I think a Friday, where they have a set group of residents who come down and play bingo on those days, and they have to have them 6 feet apart, so that makes it really difficult, to play bingo. But on the other side, in our assisted living, not the nursing home part, they're doing over the intercom and having people play out in the hallways at tables so they can stay at each end. And that seems to be going a little better, but with the amount of residents in the nursing home, it gets a little difficult trying to do that. So, but I mean, they get to do a pretty good amount of stuff considering what's going on.
So what is the overall atmosphere of your facility here in Madison, South Dakota?
It has gotten a lot more quiet. There's a lot less commotion, a lot less going on because people are cooped up in their rooms, and we can't be wandering around the whole facility because if we have something, we don't want to spread it. People are washing their hands a lot more. People are being a lot more health conscious. So the atmosphere has done a whole 180. It's usually a very relaxed but enjoyable environment. There's people around all the time, people wheeling themselves down the halls to go check out what's going on in the outlife, but they can't do that anymore.
Any closing statements, Braden Freeze?
Wash your damn hands.